Nurses go on strike at 2 New York City hospitals. More than 7,000 nurses at 2 hospitals in New York City went on strike early Monday, that's today, forcing the health centers into a frantic flurry to move patients, divert ambulances, and scale back other services. So before we get into this, solidarity with the nurses. Being a nurse who goes on strike is not easy, because you're going to be thrown, oh, we just want people to die. Oh, they need healthcare. Oh, they need healthcare. I agree, they need healthcare. And so that's why these private companies that own these hospitals should be forced to pay the nurses adequate living wages to do the job that they want them to do. I agree. Healthcare is necessary. So why don't you pay the people that are in charge of making sure people receive that healthcare? Right? Right? The strikes over working conditions, salaries, and staffing policies presented serious challenges to hospitals already facing the triple-demic. Oh, now all of a sudden, the New York Times now cares about the quote-unquote triple-demic? The only triple-demic I'm interested in is Birdemic 3, okay? But anyway, all of a sudden now they care about, oh, COVID exists. There's a pandemic, RSV. You know, they covered up all the information about it for months and months on end. But now the nurses go on strike. Oh, what about COVID? After failing to reach an agreement during a late-night bargaining session on Sunday, the New York State Nurses Association said early Monday the nurses were on strike at 2 hospitals, the Mount Sinai Medical Center on the Upper East Side and the Montefiore Medical Center in the Bronx. Quote, it is time for the hospitals to treat these nurses fairly, with the dignity and respect they deserve, to ensure nurses can get back to serving their communities by providing superior care to their patients. One of the big ways that nurses are overworked is you'll have, essentially, the way I understand it, you have certain wings of patients. Think of it like a waitress at a restaurant, right? And you have like a couple of tables, right? And you're spread thin. You got like 6 tables you're waiting on. Well, wouldn't the service be better if you only had 2 tables? Or hell, what if the whole time you're dining at that table, you had one waiter, waitress, whatever, and that was their table, and they were on call just for you for whatever you wanted? Now imagine that with hospital scenarios. You got 7 sick people, and they all need help. All 7 of them shit their pants at the same time. It happens when you're in the hospital, right? That's what nurses are for, right? Now imagine, I've seen articles, not specifically these hospitals, though I'm sure these hospitals are also a big problem here, but just all across the country, of people that, let's say, they defecated themselves. They have to sit there waiting. They hit the buzzer, you know, the little nurse buzzer you get. They hit the buzzer, and they're just waiting there in their own shit 30, 40 minutes. Why? Because the nurse is spread thin from 10 different patients. That is not acceptable. That is not healthcare, right? So the nurses, essentially what they want is they want higher wages for them and or more nurses so that they're not spread as thin. And guess what? When you have more nurses, more people get more adequate health care. So whenever you see mainstream media, you know, any politicians or anyone taking the side of the hospital on this, just know they want you to sit in your own shit for 30 minutes. They want your dad, your mom, your whatever, your whoever is in the hospital, they want them to sit in their own shit for hours. That's the quality of care that they want, that they're advocating for. If you do not endorse and support this strike, the hospitals rush to bring in temporary staff and continue operations, even pressing doctors into service to fill nursing shortages. In a statement on Monday, Montefiore Medical Center said the union's leadership had, quote, decided to walk away from the bedsides of their patients. Again, no. The CEOs said, We don't want to hire anyone to help our patients. So, fuck it. We'll let them cry in their own shit. That's what the CEO said. The CEO said, let your cancer-ridden mother cry in her own feces for probably an hour. I don't want her to have a nurse that can help. The nurses didn't decide that. The nurses have been putting up with this shit for a long time now. Right? We remain committed to seamless and compassionate care, recognizing that union leadership's decision will spark fear and uncertainty across our community. No! Union leadership didn't make a decision. They did. The CEO did. The businesses did. The hospitals that are bought and paid for by the health insurance scam industry, they made the decision. They chose not to hire the adequate amount of people that they need. They made that decision. It's like if I have a gun and I shoot you. Now, I'm not killing you. I shoot you in the arm. You'll be fine. You just got to get somewhere, go to, get patched up. And then I say, oh, why are you making the decision to go to the hospital right now? Well, because you just shot me, bitch. That's why I'm, quote unquote, making the decision to go to the hospital. So when they say, we regret the union leadership's decision, that is, in this instance, they forced it to happen. They created the conditions, and now the union is just responding, and now all of a sudden it's their decision? What? Garbage. And of course, I'm reading this from the New York Times because the New York Times is anti-union, anti-worker, and pro-suffering garbage. That's why I'm reading it from the New York Times. Mount Sinai administrators said in an emailed statement that the union leadership had walked out of negotiations at 1 a.m. on Monday morning. Our first priority is the safety of our patients, the statement said. No, it's not. They're lying. They're lying. If their first priority were the safety of the patients, they would have hired more nurses years ago. They didn't. They cut staffing, they cut wages, and they cut hours. Again, if I shoot you in the arm, can you really decide to go to the hospital? Union officials say they were fighting for pay raises to keep up with inflation. They also said hospitals have not hired enough nurses to deal with shortages created by the COVID-19 pandemic and have asked for improved staffing ratios. Quote, we do not take striking lightly, but that's what's going to happen if our bosses give us no other choice. Nancy Hagans, president of the Nurses Association, which represents 42,000 nurses in New York State. The union said that the main striking point at both hospitals was adequate enforcement mechanisms to ensure safe staffing levels were honored. No bargaining sessions were scheduled for Monday at this point, but the nurses were ready to return to the table, the union said. Now, note, by the way, that they give the CEO corporate statement first. Every paragraph, right? Think about this. This is media literacy here for you. Every paragraph. Now, I know this from being a YouTuber. If you ever, if you're a YouTuber, you have videos, look at your channel analytics. What it tells you, there's a certain graph called audience retention, right? We live in ADHD nation now, right? Audience retention. Okay? So what happens is every single second your video is playing, there's going to be a percentage of the viewers that cleave off. That go, all right, I've seen enough. All right, I'm bored. So imagine that, but for media. Every paragraph, further down you go, there's going to be a percentage of readers that go like, all right, I think I got the picture. All right, I understand. And that's why they put not the union statement first, but the corporate statement first. Because they want, and they know, more people will read it, and less people will read the union statement. The union said the main sticking point at both hospitals was adequate enforcement mechanisms to ensure safe staffing levels were honored. Blah, blah, I already read that. On Sunday night, Governor Kathy Hochul called for binding arbitration so that all parties can swiftly reach a resolution. Interesting that Kathy Hochul didn't do anything about it weeks ago, right? It's almost like striking is actually good because it forces these politicians to acknowledge you, right? Isn't that the point of a strike? But of course, Kathy Hochul is too busy shoving in an anti-abortion extremist judge into the New York courts. That's what she's busy doing. Protecting conservatives, right-wing neo-Nazi freaks who oppose abortion, gay rights, etc. That's what she's too busy doing, Kathy Hochul. Stupid-ass bitch. Fucking fuckface. Horrible, horrible example of Democratic leadership. Terrible, terrible fucking garbage. The negotiations are taking place nearly 3 years into a pandemic that has left some frontline medical workers with deep distrust for management, prompting nurses to walk out in states across the country as well as overseas. Nurses in Britain went on strike last month for the first time in the 74-year history of the country's NHS. So there's a little bit more context here. But once again, when we talk about COVID on this channel, and when I say we, I mean me, people always say, why do you keep talking about COVID? Why do you keep talking about COVID? It's the most important thing in the country right now. If you go outside without a mask on, you're responsible for this. You're responsible for nurses dying. You're responsible for the suicide epidemic in medical circles, doctors jumping off of roofs. Why? Because they didn't sign up to go to war. They didn't sign up to see the things that they had seen. And the government let them down. And their fellow Americans said, here, take some more bodies. I'm not going to wear my mask. Freedom, baby. Freedom. I don't want to wear my mask. Look at some more dead bodies. Have some more trauma. So there's a suicide epidemic. There's, a crisis of people just wanting to change their career. I didn't sign up to go to war. I'm not a soldier. I don't want to see dead bodies every single day. I don't want to see hundreds and hundreds of dead bodies every day. That's not what they signed up for, right? And so when we talk about why COVID acknowledgement is so important, wearing a mask at the fucking very least, it's not just about the disabled people who might die. Think about the nurses who are going to be taking care of those disabled people as they die. But our country doesn't give a fuck. Our country doesn't give a fuck about anything. We don't give a fuck about each other. We don't give a fuck about our own family members. That's why we fly to see our family on Thanksgiving and Christmas during a pandemic. That's how much we don't give a fuck about our family. That we fly to meet up and give each other a deadly disease. That's how much we don't give a fuck. People in this country are broken. Everyone. Me, you, everyone. Just a matter of how broken are we and can we be fixed? I think most Americans are hopeless. I do. And when I say most, I mean 50% minimum, I think, of Americans are hopeless. We're just going to have to wait for them to die off. And with this triple-demic, it'll be sooner than later, most likely. But I think there's a good chunk of Americans that cannot be fixed. And we're just going to have to wait for them to kill themselves and each other. And we have to be ready to take up the power vacuum that's going to leave behind. When the generations before us, I'm 26 years old, when the boomers die off, we got to be ready. When Gen X dies off, we got to be ready. Because if we're not, and the crazy fuckers in the millennial and the Generation Z generations, if they're the ones that take up the power vacuum, well, then we're hopping in, strapping up for another loop sesh. So once again, 100% support and endorsement of these strikers. If you are in New York and you can do anything for them, if you are in this area, get them a pizza, get them some food, get some fiber on that shit, get some spinach on that pizza, These people need to take care of themselves, for Christ's sake. Am I right? But anyway, this is good stuff, and we need to see more of this in more industries.